Rob Rochell, we know that the demographics of Cornwall are just one factor that mean that over the next 4 years, rising demand creates an additional cost or value of £39 million.
Yep.
How are you going to achieve £39 million of extra value?
It's a challenge, huge challenge. Certainly, there's an element of inherited debt in that, but also the increased demand increases the cost. So what we've actually done is, for the last 2 weeks, have a group of officers who are looking at that and coming up with designs of systems rather than what are we not going to do. It's more about how we're going to do things differently. And I think the paper that went to Health Scrutiny this morning is an indicator of us acknowledging we can't carry on doing what we've done in the same way. We want to do it differently. But I don't want there to be a message going out saying, and therefore we have to cut services. That's not the message we're giving out.
Care workers notoriously are amongst the lowest paid sector in Cornwall, and yet on the face of it, they're going to be getting a pay rise. How do you cut £39 million and give the workers a pay rise?
We'd already factored that into our thinking. Full Council agreed to the foundation living wage some months ago. So in this budget year, that was already included. So that's safe. That's not part of the savings we have to make. So the new contracts that we go to in June 2018 have the foundation living wage as a minimum hourly rate for those workers. But it's a huge challenge, and it's not new. So it's about being smarter. Commissioning. For a good example today was the savings that can be made on joint commissioning. Previously, local authority and health commissioned home care independently, and therefore that put an increased tension in the market, and the price went up. It's inflated. Now we're working much closer with our health colleagues, so that will stabilise the market and maintain the price at a reasonable price for both health and local authority.
Now, about 30% of commissioning is in what's called the spot market, and in that sector there is a proposal to actually reduce the hourly rate paid to the care providers, not necessarily the workers, but the care providers. So you're going to be giving care companies less, telling them to pay their workers more.
Yep.
Aren't they going to complain?
On a spot basis, but we've complemented that by block purchasing, and the arrangements for block purchasing are better. So what we're saying to providers, rather than take one pack or cherry pick one package, which does cost us more, to block purchase for an area, so they've got a guarantee of income, which again stabilises the market, rather than spot purchasing, which is very ad hoc and therefore costs us more. So there's a guarantee of more work and sustained income for the providers that will hopefully reduce the need for spot purchases. There will remain the demand for spot purchases. We'll not remove it, but we'll radically reduce it.
Now, the trade unions say that they remain to be convinced, but generally and broadly, they are very much welcoming these proposals, particularly the commitment to the Ethical Care Charter,
Yes.
the National Living Wage Foundation,
Yep.
and so on. What about the care providers as a trade association? Have they been consulted? Do you know what their reaction is going to be?
Extensively. If I touch on the trade unions first, you're right. The Ethical Care Charter came from Unison, one of the biggest trade unions in health and social care, and the living wage was driven by the trade unions. So we acknowledge that. The providers themselves as an organisation, this has been a collaborative venture right from the beginning. So trade union, providers, every provider of health and social care across Cornwall has been consulted in the formulation of this package. So we believe, as far as we can, that we've got it right this time, whereas previously it was the local authority saying, this is what we're going to do, and you will receive it. This time it's a collaborative venture across the whole market.
But we have already seen examples where care companies have handed back contracts because either they didn't have the technical or clinical facilities with some particularly challenging clients, shall we say, or because there simply wasn't enough profit in it. I mean, with £39 million less, there's going to be even less profit, if not a loss.
I think you're right to an extent, but what we're saying is then that we've elevated the rate per hour, so that's guaranteed. It gives me a big challenge in reducing the deficit, but these hourly rates that we set out today are guarantees. So our intention from the beginning was to stabilise the market. So we have consistency across Cornwall. across the year, because at the moment it fluctuates dramatically from Easter, September. The flow of people out of our industry into tourism, etc., is huge. What this does is guarantees that stability, but it gives me a bigger headache in terms of balancing the books at the end of the year.
So, I mean, it's a pretty radical document. One area, though, that it doesn't talk about at all are community hospitals.
Yes.
So, if you rewind, say, 30, 40 years, they would have been a big part of the mix in the kind of care that we're talking about.
Yeah.
Why no mention of them? Why not bring back some of those community facilities to help, in a more cost-effective way, the kind of care which is actually quite expensive to deliver?
I agree. Community hospitals are not operated by the local authority, and essentially today this was about commissioning care at home or as close to home as is possible. So the debate about community hospitals is an important one, and that's part of the Shaping Our Future conversation, which this document and the work we've done today will feed into that process. But essentially it wasn't a debate about community hospitals today. That's not saying that shouldn't happen, because it should and it will, but it certainly wasn't part of the conversation today.